I'm Jonathan from Prime Health, and today I'm joined again with Dr. Tonthat. Today we'll be going over some modalities that we offer regarding facial regeneration. From RF microneedling to ultrasound, there are many exciting methods of achieving a younger looking complexion. So doctor, tell me your thoughts about regenerative treatments and why you think they're important in the first place.
Oh, why is regenerative medicine important? It's part of this whole change that we're approaching in the 21st century. We have more tools available now to also make ourselves look younger as we live longer. And I think that's important. Sometimes health starts from within, but at other times, like regenerative medicine, now that we're all living older, it's good to also look young while we feel young inside.
So then moving on to some of the modalities that you offer here at Prime Health, what can you tell me about RF or radio frequencies and how they're used for treatment?
Oh, radio frequencies. We use that at our clinic to help with the regeneration of the skin, stimulate the skin to shed and rebuild faster, and to make to get rid of the wrinkles and the blemishes that we acquire throughout the years.
To that point then, what can you tell me about microneedling?
Microneedling is one of the modalities that initiates the regeneration. The objective is to cause micro injuries to your skin and stimulate your body to start healing.
So then why do you think that these two modalities go hand in hand when it comes to RF microneedling? Why do you think they work well together?
Well, the microneedling is just a point that damage. It's only a point size. With the radio frequency, if you're able to deliver the radio frequency to that point and spread it out, you create a larger damage underneath your skin. Therefore, your skin regeneration will cover a wider area and will give you a better complexions as to just a tiny little point. A tiny little point, you need more needles. Um, with our technology, you don't need to have thousands of needles. The radio frequency will help you get the result that you want with less punctures to the skin.
It seems like the point of all this is to get the body and stimulate your own skin to repair itself, right?
Right. By creating these micro injuries, you're starting the process of healing. And during that healing process is when you stimulate your body to regenerate itself. And that's how you create a new complexion, a new layer of skin, and push out the older layer of skin faster. It's like if you want to imagine molting, you stimulate your body to molt.
Right. So then moving right on along to lasers. So lasers are something that's been in the aesthetic space for a while, and to my understanding, there are different types of lasers with all different types of wavelengths, all serving a different purpose. So I thought we could talk about each one, or at least their relevant wavelength and why they're important. So starting with fractional lasers at 160 nanometers. What can you tell me about CO2 fractional lasers?
Lasers has not been a new thing. Laser has been around since the 1960s and 1970s. The only problem with the lasers up until now is that it creates such a bad burn and causing such a huge downtime. And while the result is good, most of the patients up until now do not like it because they have to hide inside the house until their skin heals. So to move forward from to today, uh, with today's technology, we can actually control the amount of energy and the duration of that laser when it punctures the skin. We can also control how tiny the puncture is. So basically, with fractional laser, you have we have just created a different method to do the same thing that microneedling has been doing. Uh, it's just with light instead of with an actual needle. So by being able to manipulate the wavelength of the laser, the size of the light beam, and how much energy within that light beam, fractional laser has become a much safer modality to give the treatment and get the results that we want without any huge downtime.
So moving on to IPL lasers at 500 to 1200 nanometers. Can you explain why a laser would have a range of wavelengths that it can use?
Right. So when we talk about laser, we also have to be uh, cognizant of what a laser can do. A laser beam is not like light. Each laser beam has a certain wavelength, just like the wavelength on your radio. If you want to catch a certain channel, you have to catch that wavelength. And so with the laser, we, we, we need to also consider the wavelength that we're talking about. Because with a laser, the treatment is very specific. Um, each wavelength can only treat one thing, can only do one thing. So if you go into an office and you have multiple problems, the doctor is going to have to need multiple different laser machines to correct all your problems. There's no one machine that can do everything. So that's why laser machines are so expensive because it's so precise and the technology to deliver what you want it to deliver has to be well controlled for it to be safe. So when we talk about laser treatment for a certain problem, just remember that we're not talking about a wavelength. We should do away with the wavelength because that's something that the doctor needs to know. Patients, they really don't need to know that. They want to know it. Or if something were to fail, you can ask the doctor why it failed, and the doctor can explain to you. But most of the time, laser machines are very precise, very specific, and each wavelength treats each specific problem.
Alright. So moving on to Alexandria and ruby lasers, some of the lower frequency or wavelength lasers rather. Alexandria at 700 to 825 nanometers, and it's known for tattoo removals. And ruby lasers down at 695 nanometers, known for hair removal. So what can you tell me about the significance of these lower wavelengths or maybe lower intensity lasers?
Well, the ruby laser that you were talking about with that one wavelength, that laser can only remove just one color of tattoos, and it happened to be the most common color, just the old-fashioned blue tattoos. Nowadays, with people who are getting multicolored tattoos and really elaborate tattoos, you have to use so many different pigments, the red pigments and the blue and green and everything else. That one laser can only do one thing. It's just going to remove blue and black. So if you have a patient that comes in with one of these multicolor tattoos, the doctor really needs to have a different machine that is able to deliver the three types of lasers, the three different wavelengths, to be able to complete the objective. So yeah, the ruby laser is good for that black and blue, but if you need more, then you need to find a different physician who has the machine that's able to remove all the different colors.
Right. So it sounds like, unlike a treatment like PRP that's so versatile and in so many applications, lasers are very fine-tuned and
Very
each have
specific.
very specific uses.
Right. Only a particular range of treatments. You cannot do everything.
All right. So then lastly, just wanted to brush upon ultrasound and its uses in the aesthetic space. So ultrasound therapy or full therapy is something that's, to my understanding, similar to M-sculpting in a sense that it uses ultrasound instead of electromagnetism to kind of contract your muscles and give you more toned and defined features. But ultrasound on your face and for the rest of your body. So what can you tell me about ultrasound therapy?
Ultrasound therapy has also come a long way since its first inception. Initially, it's called warm therapy or normal or therapy, but then in the later years, they came out with a different ultrasound that is called cold sculpting. It's the same thing, just different wavelength. One makes your body feel warm inside, and people think that dissolves with warmth. And that's why they created it. And later on, they came out with something a little bit more tolerable, and so they developed the cold ultrasound. Both with the right wavelength, it's able to do what it can do. So it's the choice of the patient as to what they want, what they can tolerate. The technology is there, and it's all operated within a safe range, so people shouldn't have any problem. The only caveat to that I would say is that each of us is differently made, so the side effects, while it exists, it's very rare. For example, there's a case with the supermodel where she went in for the cold ultrasound therapy, and it turned out that she's one in a billion who has a bad side effect, where she's left with cellulite-like side effect, where she has clots and clots and clots in different areas of her body.
So on another note, I heard that one of the main benefits of ultrasound therapy, unlike M-sculpting, is that the results are more or less permanent, or at least much longer lasting.
Nothing is permanent. We treat what is there, but if we never change our lifestyle and we return to our usual sedentary lifestyle, we're still going to gain weight and we're still going to gain fat. There's nothing that's permanent. If we negate the treatments, then we negate the treatment.
So then, just to wrap this all up and sum it all up, what would you say is the importance of regenerative treatments in the first place and why they're relevant today?
Well, today, like I said, we all live longer, and it's important to also look as good as you feel. For some of us, in our pursuit for longevity, you also want to maintain your looks, maintain your youth. There's no sense in living longer, but then not looking the part. And so It is not a treatment for everybody, but it is for those who are conscious of those two things. They go together. And here we aim to offer both of those options.
Mm. I know that you say, or you like to say that it's important to start from the inside out instead of the outside in.
Right.
These types of treatments, kind of letting your body process and
we let our body do what is natural. What is natural will maintain much longer than what is man-made.
All right. Well, that's all the time we have today. So thank you so much again, Dr. Tonthat, enlightening our audience about some regenerative options.
Thank you so much.
I know.